Hello and welcome to this recorded presentation for the Employee Benefits Program for the employees of Green Guard with a benefit year beginning July 1st, 2022. My name is Bill Hammett. I am proud to be your insurance broker. My contact information is right there on the screen if you need any help choosing plans, understanding the plans, figuring out where your doctor might be located in which one of these plans, anything like that going on now or throughout the year. Myself, as well as your senior account manager, Rhiannon Gibbs Lopez, will be available to you to ask questions, find doctors, understand benefits, help with claims, all those kind of things. We'll be here for you all year long for those type of things. Please give us a call. Quick agenda on what we're going to talk about, just a timeline of open enrollment. We'll talk a little bit about medical plans. We'll do a walkthrough of the enrollment portal. And then if you have any questions or you need any answers, please feel free to reach out to me or to Rhiannon at the number on the screen. So let's talk about the timeline of open enrollment. So our timeline is June 1st through June 10th. This is when we're asking all employees to log in and make an election, either enroll in benefits for the first time, decline benefits, change your elections, whatever it may be, or you could keep everything exactly how it is and keep things moving forward. If that's you, this should be a very, very quick process. This is also your time to add dependents, remove dependents, move from an HMO plan to a PPO plan, add dental, remove dental. This is your free time to do whatever it is that you want to do with your plans. Any changes that you make would go into effect July 1st, 2022, and we're asking that everybody be done with all their enrollments by Friday, June 10th. And you'll complete all these applications in the Ease Benefit Enrollment Portal, which again, we're going to do a quick walkthrough of that. So we've got our 10 plans available. We have 5 plans from Kaiser. Most of you are interested in those Kaiser plans. We have 3 plans for the San Diego County employees from Sharp Health Plan. And then we have 2 PPO plans for those of you that want a lot of selection, a lot of choice of your providers. So let's talk real quick about our silver plans. So we've got our 1 Sharp Health plan for San Diego folks, and then we have our 2 Kaiser plans. These silver plans are all going to be very, very similar to one another. Kind of highlighting and putting in red different parts that you should be aware of. So let's take this one right in the middle, the Silver HMO A plan from Kaiser, and let's talk about how these benefits work. So we have a deductible here at the top of $2,100. A deductible is, generally speaking, what the insurance company asks you to pay 100% of before they start paying any portion of the cost. All right. So for the silver plans, you're going to have deductibles that go from $1,650 to $2,300, and those come into effect frequently when it comes to hospital stays, emergency room visits, surgeries, and stuff like that. So, but there are exceptions to that. Wherever you see the term DED waived, this means deductible waived. This means that you do not need to meet your $2,100 deductible before you get a copay. So for the silver plan here, we have a $2,100 deductible. But if I wanted to go see a doctor, the office visit benefits are $55 for a regular doctor visit, $80 for a specialist, deductible waived. I do not need to spend $2,100 on my own before I get this copay. I get this copay from day one. If I need lab work, it's $30. So if I need to get blood work, that's a $30 copay. If I need x-rays, that's a $75 copay, deductible waived. Let's skip down to the physical therapy, occupational therapy, speech therapy, $65 copay, deductible waived. Chiropractic, $15, deductible waived. All the way down here at the bottom, we've got our urgent care, $55, deductible waived. So in these scenarios, there's lots of benefits that you're going to get before you ever have to meet this $2,100 deductible. Where it does come into effect is where you see this term after deductible. So if I needed an MRI, a CAT scan, or a PET scan, I would need to spend $2,100 out of my pocket, and then the copay would be $350. So until then, you'll pay for that service. Same thing when we get into hospital stays and emergency rooms, 45% after deductible. Okay, so let's break down a hospital stay real quick. Let's say that you go to the hospital, you're there for a week, it's a $100,000 bill. Does 45% mean you owe $45,000? No, it does not. Here's how that would work. I go to the hospital, I'm going to pay 100% of the cost for the first $2,100. That's my deductible. Then I pay 45% of the cost. Kaiser pays 55% of the cost until my 2100 plus any of these dollars, any doctor visits, any prescription drugs, any of these things, all of my money, my deductible, my co-pays, my prescriptions, my 45%. Once I have spent out of my pocket $8,200, then Kaiser pays for 100% of all covered services for the remainder of the calendar year. All right. So if I had on August 1st this $100,000 problem, that would cost me 2,100 plus 45%, not to exceed $8,200, and that includes the deductible. Okay, so that's $8,200 total dollars. So that $100,000 claim cost me $8,200, and it costs Kaiser $91,800. All right, so this out-of-pocket maximum is an important number. It ultimately is a lot of what the premium is you're paying for. It's that deal we're making with Kaiser that says at a certain dollar amount, I pay nothing else and you pay everything else. So that's your out-of-pocket maximum. All right. You can see how that would apply to these other plans. This Kaiser B has a lower deductible. Some of the copays are a little bit lower, but really not a whole lot different. Prescription drugs have a little bit lower brand name drug deductible, and how that works for, as you see with all three of these plans here, and you'll see this a lot more because prescription drugs are the #1 cost driver of healthcare expenses. So we're going to see more and more brand name drug deductibles. So let's take this plan again here. It says 500 to 1,000. And when you see stuff like this here, and you see it here, 2,100, 4,200, 8,200, 16,400, this is for those of you that are enrolled with any dependents. So if I was enrolled with my family, I would have a $2,100 deductible, but the family has a $4,200 deductible. And the way that works is no one person has any more than their individual deductible and individual out-of-pocket maximum. So the $100,000 example I gave you a minute ago, if I was enrolled with my wife and 3 children, it would still have worked exactly the same way. I would have met my deductible in full at $2,100. I would have met my out-of-pocket in full at $8,200, and my family would have the other $2,100 deductible cumulatively and the other $8,200 out of pocket. Same thing with brand name drug deductibles. If you're enrolled by yourself, it's just this first number, and it says that you will pay 100% of the cost up to $500, and then you'll get these $75 copays for brand name drugs. All right. Again, this $500, this $20, the $75, the $55, everything is running towards your $8,200 maximum. Okay. So if you spent, let's say, $1,200 in prescription drugs, and then you had your $100,000 problem, that would only cost you $7,000 because every dollar you spend is accumulating towards this maximum. So this $500 deductible is for an individual, $1,000 is for a family. So if you had one person meet the 500 and then the other 4 people all hit 150 apiece, then you would hit the family deductible. So that's where your brand name drug deductible comes into play there. Percentages across the board for hospital stays, emergency room, and surgery. So for those of you that know you have a hospital stay coming up, those of you that know you're in the emergency room a lot, those of you that maybe need regular MRIs, CAT scan, PET scans, these silver plans are going to ask you to pay your entire deductible before they start paying. So let's talk about the gold plans. These gold plans can be a little different for you. So here we have 4 plans, 2 plans for Sharp, 2 plans for Kaiser. The Sharp plans have 0 deductible. The Kaiser plans have $1,000 and $250. This $250 deductible, very low. Still a deductible, but not very high. Out-of-pocket maximums are a little bit lower. Co-pays for everything are a lot lower, okay? You see how some of these plans have the MRIs as a copay right off the bat. Some of the other ones have them after deductible, but you don't have a $2,000 deductible to meet first, okay? So it's a much lower out-of-pocket cost for those things. Then you see some of these plans don't have brand name drug deductibles. So if I got a lot of brand name drugs, I might be looking at this Gold B plan rather than the Gold D plan. All right. Another thing is hospital stay, surgery, emergency room. Now we see 3 out of 4 of these plans are covering these benefits with a flat dollar copay. So that $100,000 problem I had, let's say I'm on this Gold B plan. I'm going to pay 100% of the cost for the first $250, and then I will pay $600 per day for a maximum of 5 days. So let's say I'm in there for 7 days. I pay $600 on day 1, 2, 3, 4, 5, and on day 6, 7, and beyond of the same hospital stay, I do not pay any more of that copay. So that particular $100,000 problem would cost me 600 times 5, that's $3,000 plus 250, so that's 3,250. And on the silver plan, remember that cost me 8,200. All right. So the silver plan will cost you less than the gold plan, but as you can see, when you use it, the gold plan will save you money. So that's why I say if you have expected claims, if you know you got a lot of stuff going on, if you got things coming up, I would recommend you lean more towards a gold plan. You'll pay a little bit more in premium, but remember, premium is coming out of your check pre-tax. All of these dollars are coming out of your pocket after tax. All right. So those are our gold plans. The benefits are going to be better. And I kind of put in red some of these things. So as you're looking at this, try to figure out on a personal level what's important to you. Is chiropractic important to you? Okay, well, then you got one of the 4 plans that cover it. Is a low copay for a MRI important to you? Okay, well then maybe this Gold B plan is best for you. All right. So, or maybe if you're in San Diego, you don't have any plans going to the hospital or emergency room, but you've got a lot of doctor visits, you've got MRIs. Here's a $0 deductible with low copays for regular stuff and a low brand name drug deductible. So those are our gold plans. Now let's get to the last 3 plans. Now these plans are very different. There is 2 PPO plans here, the silver PPO and the gold PPO. All right, you see a lot of the same verbiage, a lot of the same lingo here. PPO plans are going to be your most expensive plans on a per paycheck basis, but they are going to be the most choice of providers available to you. So when you are looking at providers, PPO plans are going to have a lot more doctors in your network than will an HMO plan, but you're going to pay for it. Okay. So if you have a family that has a lot of different medical needs from a lot of different medical providers, and you don't want Kaiser, you might need to go with the Anthem Blue Cross plan. So that is going to be an important thing for you to see there. And then on the far right, you see that we have a bronze HMO plan for Kaiser. For those of you that just want an Obamacare compliant plan that's going to be there in case you have some catastrophic event, but you really don't use your health insurance for much of anything at all, this bronze plan from Kaiser is a really good buy. Very inexpensive. Will, for pretty much all of you, be the cheapest plan available. But watch out. They have, remember the deductible talk? There's a $6,300 deductible. So if you need to go to the hospital, or you need to go to the emergency room, or you need surgery, or you need an MRI, okay, you're going to have to pay all $6,300 out of your pocket before you get any benefits. Also, when you look at these doctor visit benefits and you see how it's different for this Kaiser plan, you have a $65 copay for regular doctor visits, $95 copay for specialists, and the deductible is waived, which is nice, but only for 3 visits. And they combine the regular doctor visit, the specialist, as well as urgent care. All right. So this is a combined 3 visits. So 3 regular doctor visits, 3 specialists, 3 urgent care visits, or 1 of each. It's 3 total. All right. Also, brand name drugs are going to be a lot more expensive. Last thing, I want to jump back to the PPO. You'll notice that there's level 1 and level 2 prescription drug tiers. We're going to talk about that here in a second. But Anthem Blue Cross splits up their pharmacies into 2 different levels. Level 1 is going to be the cheaper ones. You'll save some money by going to level 1 pharmacies. You'll spend a little bit more going to level 2. So those are our PPO plans. So those are all of our plans. Here's a little plug to download the smartphone app of whichever plan that you have. This is the single best thing you can do to improve your experience. If you've got the smartphone app on your phone, you're going to have your ID card in your pocket at all times. You're going to have access to your benefits, access to finding a doctor. In some of these cases, you can communicate with your doctor. You can order prescription refills. You can see results of your most recent tests. So lots of really great information available to you on these smartphone apps. So let's do a quick little tutorial of our EASE enrollment portal. So all of you are going to get this email that says, welcome to EASE. You've been added to the EASE portal. Here's our plans, mandatory June 10th. Just another reminder, if you are benefit eligible, it is mandatory for you to either enroll or decline. So everybody must do something, even if you've already been enrolled and you know you want to stay enrolled. You need to still log in. You'll click this little login button down there. I've already done that. I'm on this screen here. You log in. For those of you that have been enrolled before, you'll just log in with your password. If you forgot it, you'll be able to update it or request an updated password. And for those of you who are visiting it for the first time, you'll be asked to set up your password. So you're looking for the start enrollment, this blue start enrollment button here. You'll hit that, give you a little idea what to expect. You'll hit start. This is the presentation you're watching. This is last year's. After I finish recording this, I will upload this year's version to it right there. You'll continue. You'll fill out all your information. This is important here, so fill out all that stuff. There you see the asterisks by everything, so you got to do it. Dependents. So if you've got dependents, my recommendation is you enter them into the system here so that you have the ability to understand what it would cost to add your daughter, what it would cost to add your spouse. All right. So you hit continue once you've loaded that in. If you're on Medicare, you'll hit the continue, you'll enter that. If not, you'll hit continue. And here we get to the specify your coverage. So for those of you that have never logged in, this is all going to be gray. So what you need to do is you need to hit a check mark to say, yes, I want to enroll, or an X to say, no, I do not. If you don't know if you want to enroll or not, and you just want to see prices, hit the check mark. All right. As you hit the check mark, you're going to see all these blue buttons light up down here. And this is going to allow you to select any one of these plans. All right. I was already enrolled. I had the Sharp Gold HMOD plan, so I can see my current plan is the Sharp Gold HMOD, $82.88 per paycheck. All right. As I go down, I find my plan. Looks like my price went down just a couple nickels. And so it's already pre-selected. So for those of you that are already enrolled and wish to keep everything enrolled just as it is, it should be very easy. You just go right through. It'll be pre-selected for you. You hit continue. All right. Each one of these plans has a number of little links there for you. There's a benefit summary. This will help you understand what is covered, what the plans look like. All right. There is a link to finding a Sharp doctor. So if you want to find a doctor, it'll take you right to where you need to go to find that doctor. Here's a member resource kit for Sharp. There's a Minute Clinic flyer. And then for all these plans, you're going to see the summary of benefits and coverages. Okay. You must open this. This is a required document. And it's because Obamacare says you must look at this. This is something we must show you. So this is a compliance requirement for your employer. If you do not open this document, you'll be prompted to later on just before you sign. So go ahead and open it there, download it, save it, memorize it, throw it away, whatever, it doesn't matter. So once you choose the plan you want, you'll go ahead and if you choose an HMO plan, it's going to ask you to choose a primary care provider. You can do that by clicking on the link we talked about, or you can hit the auto assign button that allows the insurance company to assign a provider for you. Okay, this is only going to pop up for those of you choosing Sharp. If you choose the Anthem PPO plan or the Kaiser HMO plan, you are not required to choose a primary care provider. So we'll move on, continue. We only have the medical plans available through this enrollment portal. There's some other benefits that are available through other sources. Right now, we're talking about medical only. This gives you an opportunity to review. If I wanted to add my daughter, but I forgot, I could hit this edit button and go back. I could also click benefits here. Assuming this is what I want, I'm going to hit continue. I'm going to sign my forms. So for those of you that have used DocuSign before, this will be very familiar with you. You will do a typed signature. You will do a written, wet signature, if you will, with your mouse or with your finger, depending on if you're using a mobile device or not. You'll hit next, and it's just going to prompt you and take you through all the different applications, and it's going to let you just click and sign. You can scroll down and you can see the actual application here, or you can just hit the finish signing button there. If you wish to leave some sort of a comment and rate your experience in any kind of way, feel free to do that. It is not mandatory at all. Once you're finished, go ahead and hit the finish button and you'll be taken back to this home page. And you're also going to get an email from the system saying, thank you for submitting your your elections. This is what that looks like here. Thank you for submitting your elections. You're all done now. This is how you know you're done. Okay, so that's all you need to know from that. Let's go ahead and get back to our presentation. So what to do now? You're going to be looking for an email that is inviting you to log into Ease and Enroll. Everybody that gets this email must do this. If you are a benefit eligible employee, you must log in and you must either choose to keep your benefits how they are, to enroll for the first time, or to decline. Okay, so everybody will need to do something. Please do this something by Friday, June 10th. If you have any questions, you need any answers, I'd be happy to help. Rhiannon would be happy to help. Please reach out to us here. Thank you for your time. Thank you for the honor of being your benefit broker, and let me know if I can help you in any way. Have a great day.